Dr. Schwarzbach, when did you first learn about Lyme disease and started treating it?
Starting 2004, when I had the experience with multiple sclerosis patient, no antibodies, and the patient got corticosteroids and worse, 40 years, blindness, sitting in a wheelchair, and then I did the first time the ELISpot test, and that was positive that time. No antibodies, no spinal fluid antibodies, so you can also do some indication there in the spinal fluid, nothing. So the neurologist, they said it's multiple sclerosis. So okay, the story was, my starting point of view change was that time, 2004 completely, my world was broken when I found really that it was neuroborreliose in this ELISpot test. Patient was treated with Rocephin, antibiotic, 3 weeks, patient got cured completely, suffering 3 years, 4 years from this multiple sclerosis, bad blindness, and so nearly dying the next years. The patient got really improved and is healthy until nowadays.
So this changed your life?
That changed my medical points of view, what I was teach the guidelines. They said also you don't have Lyme disease or neuroborreliose if you don't have antibodies. So this is the wrong way. It's the way around. So I said this multiple sclerosis-like symptoms which were based on chronic neuroborreliosis, but it doesn't matter, the patient was cured.
So this type of events that we're here with ILADS, trying to gather doctors, trying to teach them that Lyme disease has to be seen differently and be treated. What will be your message for doctors and for patients about Lyme disease?
Yeah, Lyme disease is it's not just one patient you see every day. You see many patients with Lyme disease, but you don't know that they have Lyme disease. So what you need to know, Lyme disease can mimic a lot of chronic conditions, as an example, multiple sclerosis, Parkinsonism, Alzheimer's, autism, ADS, ADHD, fibromyalgia, rheumatoid arthritis, fatigue, whatever. So I have also panels for that with other infections. It's not just Lyme disease. Lyme is, to me, a starter. The menu is coming later, or maybe it's not Lyme disease, it's some of the co-infections without Lyme disease, or it's Lyme disease together with the co-infection. Nevertheless, Lyme is really a starter, and we need to bring the consciousness, the ticks. Also, ILADS is going the way now to other illnesses, other conditions. They say it could be also some co-infections, some opportunistic infections. That's the correct way. Because doctors here learn about Lyme disease, as I started with teaching courses from Horowitz and Boroscano that time with differentials.
Yes.
But in the end, you will see that not everything is Lyme disease, or it's multiple infection, multi-microbial infection with different pathogens, you could say. It's not just all the Lyme story, it's a vector-borne illness or tick-borne illness. So ticks are full of different pathogens, viruses, like Coxsackie virus, parasites. So the ticks are, we name them dirty needles. It's a dirty needle which is full of different, because they suck from wild animals, from the hedgehogs or whatever, or foxes, so they are full of, so, and they can transmit. But not everybody got sick from that, that's for sure. So don't fear a tick bite, but do the right steps, the correct steps after that, do prevention, that's important. Keep the tick for tick testing with PCR, with the gold standard. PCR, keep it. You can test it for a cheap price. It's around $80 for 6, for Miyamoto, for Rickettsia, for Bartonella. All together, we do a lot of tick tests, hundreds of them. And this is important to keep an eye on that. It doesn't mean that you every time would need an antibiotic. If a virus is maybe there active, you are not allowed to take antibiotics.
Any other message that you would like to give to patients with Lyme disease?
Yeah, to patients with Lyme disease, I would say never give up. You will never walk alone. Please, if one doctor is not believing in what you're telling the doctor, change the doctor, or go to a Lyme doctor, maybe from ILADS, or we have in Germany the German Borreliose Society. Go to, but don't be too much fixed on Lyme disease. It could be also some other reason, some other infection, a co-infection, a virus. We have the parasites, we have the yeast, we have the mold, we have the viruses. They all can come together in the complexity, and the whole cocktail is jumping into your body. So we have for you patients 3 eyes which need to be diagnosed and treated, also very important for therapists. I pray that to a lot of therapists. It's not just infection. Everybody has an immune system, and some people have immune dysfunction, immune deficiencies, so without knowing it maybe. So the second eye is the immune dysfunction. The infection makes an immune dysfunction. The immune dysfunction makes you vulnerable for an infection. The third eye, to me, is so important. Everybody from us has inflammation in the body. So we have inflammatory processes, inflammatory cytokines, pro-inflammatory cytokines, and we have also anti-inflammatory cytokines. So we try all to find a balance. And if you have a pain, you have for sure some cytokine storm. Some patients have the Herxheimer reactions, they name it, with this Lyme disease. When you treat them, this is pain. That means back pain, pain in your body, burning sensations, whatever you suffer from that. The inflammation is the third eye for your patients. You need to always think about that, and you need also to treat this. Yourself, you could do it easily with a good, healthy nutrition. We name it basic nutrition. We name it anti-inflammatory diet. Kenneth B. Singleton did a book years ago about that, how you could do the other books also, anti-inflammatory diet for you, basic water, no gas in it, no sugar. The natural immunity is in your gut, patients, so that's important to know. No sugar, you feed the bugs. If you take antibiotics, you destroy your flora, you have dysbiose, other viruses coming out, Coxsackie, echovirus, Yersinia, so you get a reactivation, EBV, CMV. Antibiotics are like chemotherapy, so the last years I'm on the way of natural remedies to support herbal remedies. One very good book is from Stephen Puner, what I could recommend, what I know about herbal antibiotics, and he has done a book about herbal antivirals, which also, but also you need some transfer factors, you need to support Th1, Th2, so we have wonderful things diagnosed. I'm sitting here for the infections, for the first eye, infections coming, I diagnose, immune dysfunction, you could diagnose inflammation, maybe some cytokines, whatever you want to do. On the other side, we know that, but you need to know which infection is active in your body, or which infections. We are profilers in
so
every
we need
patient.
Proper testing to know that.
We need proper testing to know which infection is active in you. Is it really Borrelia? Is it maybe a Yersinia? Is it Rickettsia? What is it? Or is it all together? And I can swear, all patients have chronic multiple microbes. We have a Tickplex Plus test, you can see that. Statistics is around 90% of so-called Lyme patients could be all have a different.
So we can
infections.
order that from your lab. Can we order this to Germany?
You could send from all over the world. It's no customs problems. We are very fast. We do it in 2, 3, 4 days, 5 days maximum. You get the results. I have a lot of discussion. I explain the results to the practitioners. If they don't understand, after a while they understand. So I teach. I do. That's free of any cost. That's my passion to explain. I like that, to discuss results. And I say, your patient has these symptoms, this arthritis. Yes, how do you know? Yeah, because LFR1 is positive, or autoimmune disorders. This is a job of laboratory, and I'm a medical doctor too.
So you help in that way, so people can have the test, and then you can discuss with the doctor or even the person.
Yeah. We always discuss with the doctors. We interpret results if they have questions.
So now you're coming to the U.S. stronger as a lab?
Yes, we will do something here. It's a little secret what we are planning for Northern America, but it's sure you cannot stop a development, for sure. It will happen. What will happen?